healthcare aspect, though, the government had expected a strong gain in healthcare spending with the implementation of the Affordable Care Act. In fact, a full third of the decline is being attributed to healthcare spending. Have you misread the impact of Obamacare?
We have not. What we have been focused on is a couple aspects of the implementation of the Affordable Care Act. The first is expanding access to health care for people all across the country. 8 million Americans signed up and took advantage of that in the first few months of, in the last couple of months of last year and the first few months of this year. That's a tremendous accomplishment and one that we're pleased about. What we've also seen is a variety of metrics that indicate that the cost of health care, as measured in a variety of different ways, has slowed. That is part of what the President views as addressing one of the root problems with our healthcare system, which is that the growth in costs of our healthcare system was rapidly outstripping even regular inflation. And that was having a terrible impact on our economy. It was restraining job growth a little bit and was even having a pretty bad impact on our deficit. So we are pleased with some of the early indications about the impact that the Affordable Care Act has had on lowering costs for businesses, lowering health care costs for consumers and families, and even having an impact on the cost of health care that's paid by the government, which is good for our bottom line and good for our nation's deficit. So we're pleased about the positive impact of the Affordable Care Act, and we're going to continue to implement that law in a way that maximizes benefits for people, including in ways that will have a positive impact on the cost of health care.